shared recently on a Walters Kluwer presentation, so I wanted to let you know that that's why the Walters Kluwer is in the bottom. Not that it is their property or their intellectual property at this time, but just so that you know, if you see it on a Walter Kluwer's presentation, it is very similar to what I shared at that presentation. And so I wanted to just start with where do we begin when we think about really re-entry? And re-entry, I think, can mean a lot of different things to different people. For what I'm going to talk about in the context of my conversation is really going to be about re-entry to the physical space, not necessarily re-entry to the start of a program, but starting to get back into the clinical space, the simulation space within our buildings, just to clarify that. And I think the first place to start is to really be knowledgeable of what is going on at the national, state, local level, as well as the institutional guidelines. I know for many of you, there may be different sites for your colleges. So for example, at Maryland, we have Shady Grove and Baltimore campus. And I know the CCBC campuses, there's Catonsville, there's Essex, there's Dundalk. And I think it's similar in some of the other areas. So be cognizant of, are there specific things that the organization or institution at the next level up, are there guidelines or are there stances that those institutions are taking with regards to any type of guidelines? And the specific guidelines that I'm going to be talking about are really related to space as well as to PPE, because those are the biggest things that are going to guide how we do things and how we consider doing things in the re-entry and practice of simulation. So when we think about space, we're really thinking about three different things. We're thinking about the capacity of the space. We're thinking about what are the cleaning options and going to guide how we use our space. And then we're going to think about the curriculum that is going to be integrated into the space that we have available. So with capacity, we want to think about social distancing, and we also want to think about what is the maximum building capacity. There is the national and guiding 6-foot principle. And in many institutions, they're using even larger square footage than that. And at Maryland, we are actually using 200 square feet per person, which previously, to put that in some context, our simulation rooms previously had 12 students and 1 clinical instructor. Now the capacity is 3 to 4 students and 1 instructor. So we have really had to divide and decrease the amount of number of students per room, which is logical, but going from a 6-foot distancing to a 200 square feet distancing is really a significant adjustment. And then there's a maximum building capacity. So that's not just how many are allowed in the room, but if you take the square footage of the entire building and divide it by the 200 per person, that gives you a maximum capacity. And the biggest reason that that is important is that when we schedule things, we in our minds think, well, we have 20 rooms, we have 4 students per room, that means that we can have X number of students. But if that exceeds what they've identified as the maximum building capacity, then you may not be able to have as many people as you think you're able to have based on that particular maximum. And in addition, you know, when we think about the social distancing, and I'll talk about this in a little bit in the curriculum, is not just how many people, but when you assign the setups for the students, remembering that something that used to happen in having 4 different stations of different skills and having the students move from station to station, now you have to set up 4 stations and each of them have to have all the skills in one station because the students can't move because of the cleaning requirements. So those are some of the things to keep in mind. When we think about cleaning, we think about not just what do we need to clean, but who's going to do the cleaning and how much time is going to be required of the people that are doing the cleaning to be sure that it's done correctly as well as be sure that there's the proper time given between the time the cleaning is finished and the time another student can come in. And those guidelines can vary. Most people are using CDC guidelines, but not necessarily. They may be using a combination of health organizations, CDC, and their own health departments within their states, which then can result in a conglomeration of different guidelines. Mostly similar, but there can be small tweaks. And then when you think about who's going to be doing the cleaning, think about what supplies are needed, but also what supplies and what equipment needs to be cleaned. I know one of the things that we ran up against was our health services, or our environmental service department is a union workforce. And so there were some union guidelines that we had to make sure that we followed. We had to meet with environmental services at the campus level. And then we had to identify what was the equipment that, based on union regulations, they were not permitted to clean because it would potentially be a liability. So for example, they couldn't clean IV pumps, they couldn't clean our hospital beds, they couldn't clean a lot of the equipment that we use for, like computers, they couldn't clean the computers. So we had to make sure that we had people that were able to do that cleaning, that had the proper supplies, not just the supplies that housekeeping used, but we had to order our own supplies for those particular people that were going to be doing the cleaning. And then putting together some type of a guideline for the people that were doing the cleaning. And one of the other things when we were working with the cleaning, and we were fortunate enough that we had a little bit of a trial over the summer, in that we had summer students coming in our clinical nurse leader program at a much smaller scale. So we were able to go through this process and start to figure out some of the kinks that we never thought of, that are going to help us as we plan for the larger numbers in the fall. But we, realized that there were some things that really needed some extra guidance, and we needed to put together some type of an explicit process that everyone was able to follow. When I think about curriculum and the space, one of the things is really talking about making sure that you remember that students can't rotate through stations within one room. As I had mentioned before, and of course making sure that the activities that are done within the building align with the learning outcomes, because many times we'll think of, well, what can we do in the building, and then realize, well, that really isn't part of the learning outcome within this course, or it really isn't part of the learning outcome within the curriculum. So just because it can be done in the building, one of the things that came up specifically was, for us, was let's teach students how to start IVs with a mannequin. Well, that was never really in our curriculum to begin with. So it's not something that we should be adding just because we can do something in the physical space. So be very intentional about how you approach what's done in the space with what is currently in the curriculum. And then one of the biggest things, and this was a bit of a struggle for us to get this information from faculty, was to really identify what are the must-dos in a face-to-face environment. So for example, there are some things that can be done in a virtual space. For example, perhaps having a student demonstrate a sterile field. So you might be able to give them, or they might be able to find a sheet or a pillowcase, and they can demonstrate how to open up a sterile field. But they can't demonstrate how to insert an NG tube because they don't have the capacity at home or the equipment to do so. So thinking about, of the 10 things that are on the list for fundamentals, what are the things that they must do face-to-face? And again, I think this was hard for the faculty, because when you own a course, you own everything in that course, and it becomes a part of you. And it's really hard to parse out, what is it that I have to do face-to-face versus what is it that I would prefer to do face-to-face. And this is really a time to parse out and hone down what are the absolute must-dos, because it's not just one course that has to come face-to-face. When you're coordinating a lab, it's a multitude of courses. So you're really multiplying what people need to do across courses, not just within one particular course. And of course, one of the things that is very challenging is PPE. And when we think about bringing students back into a face-to-face environment, not only do we need to consider how the students are going to learn, what they're going to learn, but how are we going to keep them safe and how are we going to keep ourselves safe? And so thinking about who really is responsible for supplying the PPE. Is it going to be the school that purchases it for the students? Is it going to be the students that have to purchase it for themselves? Or is there going to be information or supplies that are required by the hospital that the students are going to bring with them to the simulation space? And that's really a decision that's going to have to be made within the institution based on all of the other influences that are guiding the way they do things. Within the simulation space, identifying, so what PPE is going to be required within our space. And I'm not going to preach that there's one particular right way, because I've heard a lot of different people doing it a lot of different ways. I think, again, this is one of those things that you have to identify what is most appropriate for your institution and organization. Keeping in mind that in the simulation space, there is no increased risk for COVID transmission than there would be in any other public location. You're not dealing with COVID patients. They are mannequins or one another, and if they're keeping social distancing, then they should be able to abide by the regular social distancing guidelines. I think one thing that comes into question that we've received questions on is, well, what if a student is in clinical and then they come into the sim lab and they've been exposed to a COVID positive patient? Then there needs to be the same social distancing guidelines and the same organizational screening or guidelines that would go for any other person that may have been in the presence of a COVID positive patient. And the discussion around cloth masks versus surgical masks and face shields. And just as an example, in our institution over the summertime, the way that it was handled was that students had face shields when they entered the building. And then once they got into the simulation lab, they maintained their face shields, not their face shields, I'm sorry, cloth masks. They kept their cloth masks on unless the skill that they were practicing required them to wear any type of PPE for a potentially COVID positive patient, or the procedure, if it were done on a real person, would have had sputum-inducing potential. So for example, if they were practicing a suctioning skill, then they would have needed to put on their surgical mask and their face shield as they would have done if they were in the actual clinical setting. And then at the clinical site, and so that's in the simulation space. When we think about the clinical site and what those requirements are, most clinical sites are requiring N95 masks that require fit testing. If you are a part of any type of clinical re-entry within your program, then that is going to be something that will be a task you may be involved in coordinating, is the fit testing with an organization. And then any other site-specific requirements. Sometimes there are other types of masks that they might be required to use if N95s are not available. And I think one thing that's really important to remember is that what is done in the clinical setting isn't necessarily what has to be done in the simulation space. And I think that this can really be translated to the students as part of the fiction contract that we talk with our students about, with regards to the fact that we try as hard as we can in the simulation lab to make things as real as possible. One thing we know is that in simulation, we have limitations in our equipment and our supplies, but we do the best that we can. And we just ask that they meet us halfway in understanding that this may not be 100% like clinical, but put your mind in a space where you are considering this a clinical opportunity for learning lessons, and then they likely will not focus as much on that phrase, well, this isn't like the real setting. Well, no, we know it's not like the real setting. We're doing our best to help you get through this skill or this experience as if it were. So those are some things on PPE. And then finally, so we have this information about our space and we have information about our PPE. So what do we do with that next? I think the first thing, and I think one thing that nurses are really good at doing is saying, oh, well, we need a policy for that. So let's create a policy. And I think that it's really important that once policies are created, that they are created in alignment with institutional templates. And one of the things that we have learned through accreditation is when we are initially accredited, we had to have policies and procedures in place. And we were in the midst of a turnover of dean and hadn't gotten the processes of how to go through the policy approval process, and the new dean had some different guidelines. So we had our policies in place, and then we realized these policies really needed to go through the bigger policy approval process through the governance committees. And so just be sure that if you're creating policies within your simulation settings, that they are vetted through whatever the governing bodies are within your organization, so that they are institutional policies, so that anyone that comes into your simulation center is aware of them. And then collaborate with the stakeholders for accuracy. One of the things, and I know that Michelle is in charge of the chair of the simulation committee at her organization. And so that's the place where you really start to bring in the other people that would have input into what the policy is, the people that are in the curriculum side, the people that are on the administrative team, people that have financial information to contribute to the policy. So make sure that all of those stakeholders are included as you develop the policy to enhance the compliance. And then submit it for approval. And then I think the most important thing is that we may be really good at developing policies, but it's not as easy to disseminate to the stakeholders so that they are clear about what is expected from the policy as well as what is expected of them when they come into the simulation center, or the faculty, when you start to plan with them. These are our guiding policies with regards to use of the simulation space. So we can't have a simulation lab or a skills lab from 9 to 12 and then another one from 12 to 2, even though that's the way you used to do it. Now we need to have an hour and a half between sessions so we can clean. So now we have to rethink how we're going to schedule this. So just be clear and transparent with them. And then I think the one thing that is most challenging in this particular situation with COVID is keeping things updated. We ourselves are having a hard time staying updated, no matter how many podcasts we sign up for or how many news notifications we ask to have come through our phones. It feels like it's a revolving door and we never know when the next update is coming. So I think transparency from our end is one of the biggest things that we can do, not only for ourselves, but for those that are going to be using or working with us as we are going through this process of re-entry. So I think keeping those things updated and changing to maintain best practices and be transparent about it is really going to be a key to success as well as compliance on all ends. So with that, I would like to just open it up for questions and see what questions people have. I think one thing that's important is that I don't have the answers to all the questions, so I would hope that no one would expect me to be a walking encyclopedia here. And I don't have a crystal ball to tell us what it's going to look like in 2 months, so I won't be able to help out with that. But if there are other questions, I'm happy to either identify a resource that we can all go to or help think things through. So with that, I'll open it up to questions.